Now, I can't see your paper at all.
Okay.
But if you move it up past about your waist, I'll be able to see it. So as long as you keep it right there, you just refer to it as you need to.
I pretty much have to read.
Oh, absolutely, absolutely. And just speak loudly and clearly. This place kind of echoes, but that's okay.
Okay, ready. My name is Ronnie Gadd. My wife Susan and I moved here about 1.5 years ago. I just wanted to give you my testimony as to what happened with my journey with cancer and how God is still in the healing business. I was diagnosed with esophageal cancer in May of 2016 after I had an endoscopy to see what was going on. I swallowed a piece of ice accidentally and then began hurting when I would eat. My dad always had to have his throat stretched, and I figured that was what I needed also. After about 2 weeks of it bothering me, I finally gave in and went and made an appointment with my primary. He referred me to gastroenterology, and I had an appointment the following morning to get established with them. Dr. Patel wanted to do an endoscopy to see what was going on, and I had it 2 days later. You know how it is when you go in for these outpatient things, and once it's done, the doc runs in and talks to your driver so they can go on to the next person. Well, Susan knew something wasn't good when 45 minutes went by. I was laying there mostly asleep, unaware of the time passing. Dr. Patel came in and sat on my bed and said these words, "We will never forget." I took a biopsy, but it is cancer. Not the simple throat stretching that we had thought we went in for, and as we sat there dazed, several nurses came into the room to tell us how sorry they were for the news we had received. Never had experienced anything like this before. Dr. Patel gets in with imaging that same day for a CT to stage the tumor. Then he calls me the same day and lets me know that it was stage 2 and confined to the esophagus and possibly one lymph node. People tell us this is unbelievable, as they usually wait weeks to get an appointment. We said it's God. We asked to use Dr. Wall at Levine Cancer, as that was the doctor that took care of Mama when she had breast cancer twice. During those 3 days, I continued to go to work each morning, leaving to go to the doctor's appointments and test. Susan was home praying, and on May 23rd, when I came home, she tells me that I'm going to be okay. She says that she was praying and crying out to God for help. And suddenly she was lifted off her knees and sat in the chair and just felt the most overwhelming presence. Sense of peace and calm, and heard God say, everything is going to be okay. From that moment on, she would tell me and our family, the doctors do what you have to do. God has him. At the same time, our daughter Casey, who is a nurse at Atrium, Maine, is also working to get me the best surgeon possible. Dr. Salo was the only doctor in our area that could do the surgery I needed laparoscopically. The doctors at Atrium and Concord would have to open me up like they do for open heart surgery. I didn't know all this at the time, but I get a call from their office to tell me they just happened to have a cancellation on May 27th. God at work again. And since I didn't know all the above, I told them no. I would have it in Concord, as I didn't want everyone having to drive to Charlotte. Dr. Salo's office calls Casey to tell her that I declined the appointment, and she tells them no, he will take it. She calls to explain to me why I have to take it. When I see Dr. Wall for my appointment, and he says, you will need a surgeon. When I told him I already have Dr. Salo lined up, Dr. Wall looked shocked, sat back, laid his pen down and said, how did you do that? I couldn't have got an appointment with him if I needed one. He writes books on this and teaches doctors. We explained about our daughter working at Maine, and of course we told him God. Dr. Wall ordered a PET scan. We met with the radiation team, and the doctors tell us that this is curable. Have chemo education, learn surgery schedule for 6/16 to put in a port for chemo and a J-tube, as I will have to be tube fed once the radiation burn sets in, and also a few weeks post-surgery while the surgical site heals. Dr. Wall tells me I'm no longer able to work, that my job now is to fight cancer. Praise God, I work for a place that provided short-term and long-term disability pay. I didn't even realize when I told them what I had going on. They told me to fill out the papers and I was approved FMLA and disability pay beginning June 1st. Another blessing. Radiation began on June 14th, 35 days after diagnosis. Radiation was daily for 6 weeks and chemo once a week for 6 weeks. I finished this on July 22nd. During this period of treatment, my body rejected the J-tube and it could not be put back in due to risk of infection. Getting nutrition was going to be very difficult due to this happening. Around the 5th week, the radiation burn in my esophagus made it impossible to eat without horrible pain. For the next month, I lived on room temperature vanilla Ensures, which I had to drink magic mouthwash to even get it down. I lost 40 pounds. Scans showed that radiation and chemo did their job for shrinking the tumor, and it would continue to work for the next few months. My surgery was scheduled for October 13, 2016 to remove the remaining tumor and some lymph nodes. The surgery involved removing the part of my esophagus where the tumor is, then pulling my stomach up to attach the esophagus. This is called an esophagectomy with gastric pull-up. This surgery took 8 hours with me laid on my left side and my right lung deflated so that Dr. Salo could reach the areas needed. Surgery went as expected and I was to be in ICU 4 to 5 days with a total stay of 7 to 10 days. I was doing so well that I was moved out of ICU 1.5 days later. Keep in mind that at this time I had a tube down my nose to drain my stomach acid and about 6 drains coming out of me from the surgery, but yes, I'm doing great. As a result of this type of surgery, I'm not able to lay flat as part of my esophagus that was removed contained the flap that closes to keep stomach contents where they belong. If I lay flat or bend over too far, my stomach contents come up and also go down into my lungs. The first obstacle I had to overcome was the swallow test, and I was taken down for this test on a Saturday, about 3 days after surgery, and told the staff that I could not lay flat, but they did it anyway. And the story I hear from Casey and Susan is that they nearly killed me. Susan said to them when they brought me back to the room, "What did you do to him? Something is wrong." He said, "And he was fine when you rolled him out of here." Casey called for nurse and I was rushed to x-ray. I had aspirated when they laid me flat. I was sent back to ICU. My lungs were in bad shape. They said they needed to use a BiPAP on me to clear my lungs, but could not put the needed pressure on them as they could rupture the surgical site. I am told all of this later as I don't recall all of these details. I was on 60 liters of oxygen at one point and they had to take me for a test, and thank goodness Casey was there. As they were going to roll me out of the room with one oxygen tank, Casey stopped them and said, "Do the math. You will not get to where you are going with that one tank and the amount he was on." Praise God, my daughter was there and is a great nurse. Due to this setback, I'm in ICU 8 days before going back to regular room. And after many failed swallow tests, I finally passed on October the 26th, 13 days after surgery, and it should have happened on day 2 to 3. This aspiration was a huge setback. My body continued to reject feeding tubes, and I had to have a PICC line inserted and given liquid nutrition. Finally, before I could be released, I had to have a 4th attempt to put in a feeding tube so that I could be fed at home. As I still can't eat by mouth, Dr. Salo decided to take me into surgery and place a different type of feeding tube. So finally, 17 days later, I am discharged home. Chemo education.
You all right?
Yeah, I just skipped.
Oh, gotcha. I do that all the time.
Okay. I managed to keep this one in long enough to use until I could eat by mouth, which was about 6 weeks. I was fed by this tube at bedtime and it would alarm when done. And Susan would get up and unhook it. I had drains still in me when released, and finally, when they were removed in the office, it was a great day. All the way up into 12 a.m. when Susan wakes me up to say, "You're burning up." Checks my blood pressure and heart rate, calls Casey. She says, "Get dressed, we are going to the Atrium Main ER." Sounds like sepsis. We enter and I tell them my issues and they treat me as code sepsis. I go to an ER bed and 30 minutes later, my fever breaks and I feel fine. Susan and Casey just shake their heads. I have no medical intervention yet, not even a Tylenol. God again. When they come to the room, I tell them I am fine. They recheck vitals, and sure enough, blood pressure, heart rate, and temp all normal. They cancel code sepsis and tell me to follow up with my doctor the following day. At the surgeon's office, all the surgeon's office can figure out is that when the drains were removed, maybe they stirred up some bacteria and my body was fighting the infection, but it was God. I had several issues of food getting lodged in the esophagus and having to have my esophagus stretched. Now this is part of normal life. The site where the stomach and esophagus were joined can narrow. Have had this done 4 times since surgery, but I'm here to have the issue. I cannot lay flat, have to sleep reclined, and that causes issues, but I'm here to have the issue. I continue to have CTs and PET scans every 3 to 4 months. And 18 months out, Dr. Wall calls to say, you are the last person I wanted to make this call to. 2 lymph nodes are measuring larger and active. The blessing is that these 2 lymph nodes are not connected to each other, meaning the cancer was most likely contained in these nodes. But the course of action was radiation and chemo again. No surgery for this. I was now considered incurable. Inoperative, stage 4 metastatic cancer. They said, we can treat you, but we cannot cure you. Chemo education again, as these are different chemo meds than the first time. This chemo had some weird side effects. Could not touch cold things without pain. First bite syndrome, meaning every time I would eat, the first bite would kill me. And neuropathy. I still have neuropathy now in my feet. At least it left my hands. God again. Radiation wasn't as bad this time as it was targeted just to the lymph nodes, so my eating was not affected. When I received my 4th round of chemo, I was so sick, nauseated, and I didn't move for 2 weeks. Couldn't move. Had to go in for fluids as I was dehydrated and ended up with blood clot in my calf. Come to find out, the chemo nurse that administered the 4th round came to us and told us that it was her fault. She had neglected to give me the long-lasting nausea medication. It was left off of my orders and she missed it. She was so upset over this. It was just a mistake. So at this point, I am placed on blood thinner due to the blood clot. We make a trip to Oak Island in hopes to get some fresh air and a break, but I am so sick I could hardly walk to the end of the pier, so out of breath and weak. When we get home, I have a regular CT scheduled to check on my cancer. We leave and go to get us and Mom some food and get a phone call to come back to the hospital ASAP. I said, can I eat first? As I had to fast for my first scan. They said yes. So we ate and back to the ER to find out that I have bilateral blood clots in both lungs. The spell I had at the beach walking to the pier to fish was when the blood clots in my leg moved through my heart. God saved me from that. But thanks to God, here I sat just fine, and the ER docs don't know what to do with me. They say protocol for stage 4 cancer patient with blood clots is admission and IV blood thinner. But I'm already on blood thinner, and I'm sitting here just fine. They had no reason to admit me and leave it up to me what to do. Really, this happened, so I went home. That was in 2018. I continued to take immunotherapy medicine in the chemo lab for the last 2 years, every 3 weeks. This medicine can damage the heart, so I also had to have an echo every 3 months and CT PETs every 4 months. It was a full-time job. Dr. Wall retired, and I have a new oncologist, Dr. Laura Musselwhite. She is wonderful also. She and I talked, and we took my case before the tumor board to discuss stopping immunotherapy, as I wanted to stop it, and she agreed I was okay to do so. But they have no precedence to do this, as no one with my diagnosis has ever gotten to this point. She said I'm in the 1%, and I'm a case study for them. So now I'm off treatments for going on 2 years, still have scans every 6 months. This should stretch out as time goes by. So to say I'm a miracle is true. But what I really am is a walking testimony to God. For He is the reason I'm here. Thank you.
That's so good.